In our morning rounds, the FDA is proposing the first changes to breast cancer screenings in decades. It wants to require mammogram providers to notify women about their breast tissue density. About half of women over the age of 40 have dense breasts. High breast density can obscure cancer signs. It's also an additional risk factor for breast cancer, which is a leading cancer among women. Our Dr. Narula joins us at the table to discuss. So knowing your breast density is very important, it seems.
Very important. So let's talk about
why is it not normally, why is it something that we don't know?
Well, that's a great question, and that's why we're educating about this. So we have to understand the anatomy of the breast first. The breast is made up of lobules, which are the glands that produce the milk, the ducts that carry the milk, fibrous connective tissue, and fat. So depending on what ratio you have of those components will determine how dense your breasts are. You have more fibrous connective tissue and glands, more dense. More fat, less dense. The issue comes up is when you do a mammogram, the mammogram is an X-ray. So the fatty tissue looks dark and transparent. You can see through it very well and pick up on those bright white spots that might indicate a cancer, for example. The difference is with dense breasts, that dense fibrous connective tissue and glands also looks white. So it's very hard to differentiate between your normal dense breast tissue and a cancer. It's like looking for what they say a snowball in a snowstorm. And so you don't know if you have dense breasts without a mammogram. That's the only way to tell. You can't tell by the size or how firm they are. And there is an increased risk of cancer with dense breasts, both because it's hard to pick up the cancer, but also because there is some innate inherent risk with denser breasts that we're still trying to figure out why.
How significant how significantly higher is the risk?
Well, it is higher. And so, we don't have necessarily percentages, but the point is that women who have dense breasts may want to get further testing done. And so, there was a woman who was a PhD who had a normal mammogram who about 6 weeks later was diagnosed with stage 3 breast cancer. And she started an advocacy group called How Dense Are You, essentially? Are you dense? Because most women don't know. And if they know, which is what this rule is proposing, they might ask their doctor for further screening tests like an ultrasound or an MRI. So the new rule would send a letter to women that says you are low dense, you are high dense. This is the significance of what that means. So it's all about empowering the patient.
Right, because right now doctors are required to tell patients if they have higher breast density in 36 states, right? That's going to be a national law.
Well, the hope is that this would be a law that would go through that, yes, would be a requirement.
So what causes it, and is there anything you can do to reduce it?
So some of it is genetic. You just may be predisposed. Some of it could be if you're on post-menopausal hormone replacement therapy, if you've never had children at an older age, or if you have a low BMI, and also in younger women, we tend to see it.
So it's not like you can prevent it. If you have it, you have it.
Yes.
Okay.
Definitely worth having a conversation with your doctor.
Absolutely worth discussing it.
Tara, thank you.